Well, we are going to have, you can go ahead and record.
Awesome.
Awesome. We're going to have Kristi, who is a physical therapist and owner of Aquatic PT and Beyond, talk to us today about the fall risk factor of osteoporosis and posture. So again, we're trying to find these modifiable risk factors, talk about them, learn about them, and then make changes to impact our risk for fall. So we'll let it go.
Are you down in Raleigh or are you
In Raleigh, we're right at basically Falls of Neuse and 540. So North Raleigh, but still Raleigh.
I've heard of someone, but I thought they were closer to the forest.
I don't know. Yeah, not too far though. Well, like she said, I'm Kristi. I'm a physical therapist. I've been doing this for about 22 years. And I own Aquatic Physical Therapy and Beyond. My husband and I opened that about 21 years ago. And for us, it's a great environment. I don't know how many people, I feel like you want to go to physical therapy about as much as you want to get a root canal. So it's a very lively, fun environment. We feel like we have always staffed the place with good skill set, but really good personalities, good work ethic, good team effort. It's important. We want to be able to help you do the things that you may or may not want to do on your own, and then hopefully be an annoying voice in your head so you continue doing those things and keeping yourself active and moving. So Krista talked to me about doing a little talk on osteoporosis and posture, which was really interesting to me because I'm always excited about kind of catching up on some of the newer trends, because I'm sure they've changed here and there a bit since I went through PT school. I also recently went through a Pilates certification because I was bored. I have 2 teenage daughters. I own my own business, sleep a few hours. I thought it was a good time to get a certification. But what I love about Pilates and why we have incorporated it into our clinic is it seems to be a form of exercise that really works to stabilize the core muscles. I feel like every one of us can say that we're a little bit weak through the core, we're a little bit tight through certain muscle groups. So I always say Pilates is kind of that form of exercise that can help hold you together to do the other things you want to do, to go out walking, to go antiquing, shopping, skiing, whatever. But it's a really good form of exercise. It just seems to be all over the place as to how it is instructed. A lot of the classes I wouldn't send any of my patients to because I feel like the exercises really need to be catered to what individual people need. A lot of people are different as to what their spines can do, whether they should or should not flex, whether they should or should not extend, things like that. So we've taken the concept, we've put some equipment in the clinic, and then we've let our physical therapist brains go wild with it. And it's been really, really a fun adjunct. So we do have an in-house physical therapy pool. We have the Pilates. We do a lot of hands-on work. We kind of built the clinic saying we want to be able to take care of anybody who walks in the door. So I don't care if it's somebody, I actually had a patient for a while that came in on a stretcher and we got her into the chairlift, into the pool, and the exercise she did with me was all she did until the next time I saw her. So I've seen everything from that level to a fireman that we had to make sure he could be able to throw a 200-pound person over his shoulder and get out of the building. So I feel like it's important to just have a little bit of everything for everybody, and then, just put your mind to work to pair with your patient and be able to do what helps them. It doesn't matter, if what you need is different from what you need. We need to be able to work with each individual person. And again, get you on the road to recovery, but then again, get you on your own so that you know exactly what to do and not hurt yourself moving forward. So just to kind of review for me, osteoporosis is basically a condition that weakens the bones, making them more susceptible to fracture. There's a lot of concepts that we want to be aware of with osteoporosis, but probably the number one thing is we really don't want people falling when we know that there is diminished bone density. There's a higher risk of injury, more complex fractures that can occur, things like that. So I feel like above all things, the top priority is to really help anyone dealing with osteopenia or osteoporosis to know how to minimize the risk of falls in all arenas of their life. Oh, wait. Boom. There we go. Sorry. I love people and I love the human body. I am not great with technology. So my amazing 13-year-old actually sat down and forced me to put slides together. So this is a lot of her work. We love her. Thank God for her. I'm sure she'll be helping me with electronics for the next 40 years. So thank goodness. So this just kind of shows, I was trying to, I don't know how we get into the most medical conversations at my house. But when I was trying to explain to my husband and my 16-year-old last night what we were talking about the bone density and how basically if you looked at a sponge, the sponge with smaller holes and more sponge material would look like a normal bone. And then if we had one that had bigger holes, less sponge material, that's looking at a more osteoporotic bone. So more air or space within the bony makeup, it just, again, weakens it a little bit, makes it a little bit more susceptible to fracture. Let's see if we can do this again. Hold on. Posture. Posture is a position in which someone holds their body when standing or sitting. This picture gives us a nice image of sitting posture. I find this to be more and more interesting because the number of people I feel like I've worked with over the last few years since they're working from home and have back pain, I like to point out that they are not sitting on the couch in a slumped position with their feet up on the ottoman. Somehow that is not ideal sitting position. I don't understand how that's right. But it just kind of points out, to me, I feel like this really applies for anybody who's doing anything at a desk or a table, as well as driving, if you think about it. A lot of the cars now have really nice lumbar support. So you do want your spine to be in contact with something. The lumbar support should be pressing against it. Something else that I have found is really, really helpful to sitting posture. My parents live in West Virginia, so I do that long drive a lot on my own. And sometimes just taking a towel roll or even a jacket and rolling it up, if you put that vertically kind of between your head and your low back, you notice most chairs kind of put us in a position where everything kind of moves forward. Same thing with airplane seats, things like that. Sometimes just putting a vertical soft towel roll behind you just kind of helps open all this up, and you'll find it helps minimize little spasms and cramps in your back when you're driving. I don't know why, but they don't put them in the chairs. You can spend $500 for an ergonomic chair, and you just need to stick a towel roll back there. But this gives a nice little picture of basic sitting posture. The next one is going to show us our standing posture, which is super fun. This just kind of takes, back in PT school, we had these fun little plumb lines that we would hang from the ceiling, and then everybody would have to kind of stand against the plumb line, and it would show where everything lines up from the front or from the side. And you can see the ear kind of lines up just around the shoulder, where the shoulder lines up to the knee. That's ideal. And again, we spent a lot of time in PT school going over ideal because we're not usually treating ideal. Most of us don't have ideal. So this kind of gives a nice little alignment. I thought we could have some fun with the lab today, where we kind of look at maybe where some of us fall with that ideal alignment and some really basic exercises that can blend right into your day to help move you toward the ideal in different areas. I feel like we all have little areas that we could benefit from. The thing with posture is ways that things can, unfortunately move away from ideal. They can be structural or they can be functional. Structural would be actual bony changes. Like sometimes with more advanced osteoporosis, the vertebrae in the spine actually start to wedge, and it could cause a little bit more of a kyphosis. Sometimes due to injuries, fusions, stiffness in joints, different things like that, will kind of change the bony alignment of the body. Functional alignment has to do a lot more with soft tissue and certain areas being tight, certain areas being weak, or how we posture away from pain. That also ties into it. So sometimes as we kind of learn how to use our muscular system to kind of stack us up against gravity better, it can take away some of those aches and pains that we're having to shift away from. So of course, that's the good news. The body's made very redundant. I don't know that any of us were made with the ideal skeletal alignment. I think we all have our own little quirks. But the more we can have the muscular system with the muscles strong and balanced and flexible, the better that's going to hold us up against gravity and keep us from falling. I know, I probably should look at these. So because a big part of our mission is to help make sure that you guys are informed and knowledgeable about how to avoid falls, I thought it was worth going into the 3 systems that are responsible for our balance. I feel like I end up explaining this a lot because we do work with patients in the water a lot. The 3 systems are the eyes. This is important for a couple reasons. Obviously, anything that is affecting our vision, whether it's simply not putting our glasses on to get up and go somewhere or do something quickly, or keeping the lights dim, things like that. If that is affecting your vision, that can also affect your balance. So that's just a little tidbit to kind of file away and be aware of. The other is your inner ear, which I continue to think is just a miraculous system in the body. The inner ear is going to be responsible for relaying to the brain exactly what our positioning is. If we're tilted to the side, if we're straight up, if we're leaned forward, the fluid within the inner ears actually communicates to the brain to let it know your positioning and what's going on. Things can affect that. There are neuritises that can affect that. There are, we actually treat patients sometimes for something called BPPV, which is where the crystals kind of get lodged in the wrong place, and it will cause a terrible vertigo, which would obviously really hinder your ability to get from point A to point B. This is kind of a little snippet area of what we'll do in physical therapy, but also on the positive side, a really quick fix. There's really quick, easy maneuvers that the PTs can do to kind of get those crystals dislodged and back where they're supposed to be and get your world to stop spinning. So if that's something that ever occurs, you want to get help for it. The other thing is the joints have what I call mechanoreceptors in them. So the mechanoreceptors are constantly telling the brain what muscles to engage and how much or how little to engage them. That's why if you ever watch somebody trying to stand on one foot, those little ankle muscles work really, really hard to hold you stable. That's the little receptors in the ankle saying, you need to lean right, you need to lean left, you need to fire this muscle, you need to do this. Swelling in your ankles is going to make that a little more sluggish. A surgery, arthritis, disuse, anything like that is going to change what I say is like the speed of the mechanoreceptors communicating to the brain. So if my mechanoreceptors aren't responding as quickly, I might be all the way halfway down before they even tell my brain that they need to correct it. The nice thing about that is it's one of those things where practice makes perfect. So the more you do safe exercises to work those mechanoreceptors communicating to the brain, the faster they become and the better your balance gets. So it's a very progressive type of exercise routines, things like that, that you're able to do to get that better. So again, we don't look at anything as being, well, it's just there because it's swollen, or it's just there because that's my bad knee. There's always either systems that can help cover for the system that's weak, or there's things that we can do to kind of help hone in those things and make them work a little bit better. So that was just a little tidbit in that because I feel like it falls into everything else. Flipping back to osteoporosis, the wall or the rule that has always been in place from when I learned about it 22 years ago, they call it Wolff's Law. And Wolff's Law is the idea that natural healthy bones will adapt and change to adapt to the stress that it's subject to. On the negative side, that's the same thing that happens with arthritis and arthritic spurs and things like that, right? If that bony joint is under a great deal of stress, the body thinks it needs to lay down more bone. That doesn't always work to our benefit, but it's the same law. When it comes to osteoporosis, the thought is And the research is the more we're able to do where we're putting stress or weight bearing or muscle contractions on those bones, the more they'll lay down bone and help make up for some of that lesser density that we have. So there are various exercises you can do, and there's also some kind of conflicting literature on them, but I'll tell you why I think some say it works and some say it doesn't work. But at the end of the day, if your muscles are stronger, your bones are going to keep you up against gravity better. Make sure that I've kind of gone over a couple of these things. I should refer to notes every now and then. There was an argument that aquatic therapy and swimming was not beneficial to osteoporosis. The flip side of that is more research was done to say it's not just your weight bearing on your bones, it's if you're contracting a muscle. So if my bicep muscle attaches to the bone here and attaches to the bone here, every time that I shorten it, it's tugging on the bone and it's tugging on the bone. So theoretically, that's creating a little bit of stress, so it should also help the bone a bit. That's where things are kind of out there. I do feel like because the water can be so helpful to enable you to do more than you could do on land safely, I think that it helps patients improve their balance because those mechanoreceptors work harder, partially because your visual system is a little bit disrupted. You know, when you're doing anything in the water, if you look through it, everything's kind of moving and it doesn't look quite right. So your brain has to kind of say, okay, I'm going to have to ignore that. And in order to keep you balanced in what you're doing, we're going to have to depend a little bit more on those receptors in the joints. So that goes back to the practice makes perfect. You get better balance even when you're doing stuff in the pool when you come out and you do stuff on land. So if in the pool, you can stand on one foot with your eyes closed because you're not going to fall far, for one, right? But also if you're safer, you're more supported, you're able to do it. That will improve your ultimate balance on land as well. It does have carryover. When the types of exercise they will typically talk about to help improve osteoporosis, the number one is any type of strength training. I think it's important that whatever type of exercise you do, and I love the activity logs. I think we all could use accountability. I need accountability and an activity log. But I think it's important that you enjoy it and it's safe. With weight training can be anything where you're creating some sort of resistance to work the muscles. I know there's a lot more seated exercise classes, so there's no risk of falling, but you're building the muscle just like you would. Pilates, there's actually equipment like a reformer. We have some patients that actually can do Pilates exercises because they have a disorder where sometimes when they're vertical, their heart rate will go up and they'll pass out. They can actually do the strength training lying on a reformer, and the springs are used for resistance. So you still get the resistance, it's safe, there's not a risk of falling, but it's another way to get the activity to get the strength. When they talk about cardiovascular exercise, that's anything that you're moving and getting the heart rate up. Initially in the article, it said that they recommended, more weight bearing than aquatic or swimming. But again, with the water, you can vary how much. If you're thigh high in water, it's going to be more weight bearing than if you're shoulder high in water. So there's variations. You don't not exercise because something doesn't work. There's always something else out there. Sometimes we just have to get creative. Excuse me. If you enjoy walking, something that kind of helps to build the muscle more than just kind of walking leisurely would be if you try to incorporate some gentle hills or if you vary your speed. So maybe for 1 minute you want to walk faster, and then for 1 minute you want to walk a little bit slower. Anything that's challenging the body a little bit is going to help build more muscle, and hopefully improve the bones as well. Let's see. Let me see, what else did I want to go over there? So like I said, for the lab, I thought it might be fun. I think one thing I forgot to touch on was when we kind of talk about the connection between osteoporosis, posture, and risk of falls. When we looked at that picture of the person lined up with the ideal posture, I think we can kind of get an idea that if someone is perfectly upright, the center of gravity kind of sits within the center of the body, right? But if anything pulls us more forward, that center of gravity is going to be more forward. If anything like scoliosis is very common where the eyes are always going to try to be level. So anything that's going to go on at the spine is going to have to be corrected by the head and neck. So if scoliosis is in effect, then we're going to have to shift the position of the head to kind of be able to see everything level. So again, that's going to change our center of gravity a little bit. So it's, I guess that's as much of an awareness as it is to be able to use the right assistive device or anything like that if that center of gravity is something that would be pulling you to be more prone to falls. It's a lot of information. Does anybody have any questions?
Will medical insurance cover this?
So the question was, do all medical insurances pay for this? We are physical therapy, just like any other physical therapy. We are contracted with certain insurances. So it comes down to like, I had someone asked me just a little bit ago, what was your name? I know. About Medicare. We do work closely with Medicare. We are contracted with a number of insurances, and any that we're not contracted with, we always look to see if there's out-of-network benefits, and we do our best to work with the patients. So we fall under medical treatment, just like any other physical therapy clinic. So then it just comes down to the individual insurance and what they cover. And they would cover the Pilates and the aquatics just like they would cover anything in the gym, because it's the same level of expertise and all the other guidelines with physical therapy. Of course.
If a person has shown osteoporosis in their hip and they do exercises for their upper body and posture, does that affect their hip osteoporosis, or do you have to do exercises for the area of the body that the osteoporosis is diagnosed in?
My understanding would be the other areas of the body will benefit by not declining, but if we already have an area that is osteoporotic, it would be important to put stress on that area of the body to build it up. And anybody who's dealing with arthritis or anything else, you know that because an area is weak or painful or stiff, if we stop using it, it's going to get more weak, more painful, more stiff. So I would say the same would apply to osteoporosis. We know it's a weaker area, so we want the muscles to be that much stronger. Yes, ma'am.
Is there a particular exercise that would help with the hip and the muscles in the hip?
Yes, and that is like one of the only ones I didn't take a picture of today, but I can pull it up. I think what we run into, society, and I'm talking all ages, all walks of life, I think most of us are weaker through the hips and the gluteal area because we are a more sedentary society. We have even treated like runners to help them learn to engage their gluteal muscles because they don't use them. So the muscles of the hip, there are some very focally pointed exercises that will help to strengthen that area. That honestly is important for everybody, but yes, there are exercises to help strengthen that. So I'll get with you at the end.
Get them.
Yes.
If you're having surgery on your knee, replacement, is the pool or the water treadmill, underwater treadmill, good for regaining your strength in that
It is. So I kind of look at it in two ways, right? When we first started the clinic, oh, and the question was if you're having, it was knee replacement, right? Is the pool beneficial for that? And I would say there's great aspects both before surgery and after surgery. When we first started the clinic, of course, I was, young and I just wanted to make sure I could just fix everybody. We had so many patients come in that were trying to avoid a total hip or knee replacement surgery. Those that did like 6 to 8 weeks of aquatic therapy beforehand, and for most of them, they only did the pool because it was already painful. The joint was already degraded enough that it needed to have surgery. So we did pool only. If we did several weeks before surgery, I felt like I hardly saw that patient after surgery. It was so great because when something hurts, if it's a knee, it's going to change the way you walk, right? Maybe you don't get as much bending, you don't get as much straightening. When you see the stairs, you use the other leg. When you get into the car, you do it differently. So what you've done, depending if it's months or years, is you've created movement strategies that are not beneficial. You will still have those habits and strategies after surgery, you just have a new knee. So if we can fix those things before surgery, I feel like you come out of the gate so much better. So I love when I can get patients in even for a few weeks before a joint replacement. I feel like they come out so much better. And then after, of course, it's usually land-based until the doctor says we're allowed to get them in the water because of the scar. We want to make sure that absolutely everything makes that surgery successful, so we will wait until the doctor says go. But usually by that point, you're moving, you're walking better, and the pool is just going to help with swelling. It's going to help, again, regain those normal walking mechanics that maybe you haven't had for a while. Yes, ma'am.
Could you explain how eyes impact our balance?
How eyes?
Vision.
So the question was, how do your eyes affect your balance? And we could all do a drill, but we're not going to do that right now. The way the eyes affect the balance is it's one of 3 systems that sends input to the brain to tell your body where it is in space. You will notice if you try to stand either with your feet together or one foot, if you had things to hold on to, it is a lot easier for me to stand here on one foot with my eyes open than with my eyes closed. When I close my eyes, I lose that 1/3 of input to my brain, and so it makes the activity harder. So if you correlate that to glasses, dim light, anything like that, it would have a similar effect with day-to-day life and in your home. Any other questions? Does anybody want to be a guinea pig for my lab? So, not to put anybody on the spot, but what I thought we could do for the lab, my husband was going to make me a nice little plumb line, and then he was like, Kristi, forget it. If I can just kind of eyeball your general alignment, there's usually 3 to 4 areas that we're almost always correcting. Number 1, and I like to call it iPhone neck these days because it's everybody. What happens is, and I don't care if we like to read or if people are on the phone, what happens is we start to move our head toward whatever it is we're looking at, right? So what that does is it takes this nice curve and it puts all the pressure right here on your lowest cervical vertebrae. So it can create a lot of pain, a lot of tightness through here. That's one, which I'm sure nobody in here has. The second one is, like I mentioned, when you're sitting in a chair or a car, I don't know why, but I feel like everything kind of conforms us this way. And I think because we do so much out in front of us, we're never doing anything behind us. Most of us have shoulder blades that kind of round forward. Shoulders that elevate, I think that's sheer stress in life. But all this kind of comes forward, so these muscles get a little bit short and tight. And these guys are like holding on for dear life because they're on stretch all the time. So for our static posture, if we're sitting for prolonged periods, if we can just give them a little tactile cue or something touching them to remind them that they still matter, and that maybe if we just try to pull our shoulder blades together a little bit, then we get better blood flow to those muscles. We take them off tension, excuse me. That would be number 2. And then the other area that I always look at with patients is right around the pelvis. Obviously, the center of gravity is important for everything we do. 90% of the time, we are either one way or the other. If you notice that somebody has some low back pain and things tilt a little bit this way, you can assume that hip flexors are a little tight. So this,
Okay, forward, okay.
yes, this is what I would call like an anterior tilt. Usually these muscles are relaxed, these are tight. So I put together a little sheet that's got stuff for that too. The other thing that you might see is the opposite, where everything is kind of tucked under here. And this was actually something I picked up on in my Pilates course. People who sit for their work and life more tend to have more of the tight hip flexors, relaxed abdominals, and they're a little bit more here. People who stand all day for their life and work tend to find a way to just kind of stack up on their bones and not use any muscles. And so sometimes they form their body into a little bit more of this position, which was something I obviously thought I was perfect before I did the Pilates certification. And that was one thing we all got to evaluate one another. And she's like, you obviously stand for your work. And I'm like, well, I've been standing for 20 years for my work. Yes. And the more I sit down, the more I just have to get back up. So it's always interesting to learn things about yourself and what to do about it, I guess. So I did bring some sheets that have some of those exercises if anyone's interested. Yes.
Tell me how bad it is to sit with your knees crossed. I do always.
And I think my physical therapist answer is 100% you want symmetry. And that's just because I can just go, okay, these are the muscles that are constantly shortened from that position. So anything where a position holds a muscle short and tight can cause trouble. I think it's a habit. I think most of us do it because it looks better. We've done it from an early age, right? I think the downfalls are, I think the more you do sit with your legs crossed, I do think it can affect sort of the blood flow and the capillaries there too. What I notice is, particularly if people sit a little bit more this way or even this way, it is going to tighten these little hip muscles that we were talking about earlier. Tight hip muscles consistently correspond with pain that kind of radiates down the leg. So that would be, so that would be the reasoning. And I would say it's the same thing driving. Like I would be the person where I'd have one foot on the gas and then this one would be kind of like this. Also a really bad idea. Because when you go to get out of the car 4 hours later, all this is going to be tight and short. So when in doubt, go for symmetry, right? Both feet on the floor. Same thing with standing. A lot of us stand one way or the other.
That's a girl thing.
Right? It's so true. But again, if you're stacking yourself just up on your vertebrae, you're probably not using any muscles and you're putting more pressure on one side or the other. If you can try to get used to putting pressure on both legs, engage the abdominals, bend the knees just a little bit, so this can't happen, right? Just bend the knees a little bit, then you know your quads are working, your abdominals are working, and you're steady on your feet. Versus constantly shifting over.
Is that a bad thing to be, I mean, not shifting into a stance, but I find that if I have to stand for any length of time, and I do when I'm teaching,
Yes.
I either walk around or I rock backwards and forwards from left to right, just try and keep.
I would say play with it and see how you feel at the end of your teaching. I'm always a fan of walking. I think walking and moving is good. But I think you might find that if you spent more time kind of shifting, you might just feel a little bit more discomfort through your hips or your low back, versus if you can get used to trying to stand, weight on both feet, engage the abdominals, you might feel like your backs are moving.
but just a little weight shift on from left to right? I mean,
If
it's
it's-
part of my knee.
If it's more this
Yeah.
versus
No,
this.
yeah, it's just
Yeah.
minimal.
Yeah,
Yeah, okay.
that's probably right. I mean, we all kind of do what we do. There's not everything we're gonna change, but the more we know about, or we feel better when we do things a slightly different way, that's great.
Let's try the neck exercise that they have the picture in front of them.
Oh, perfect,
So why don't you
okay.
walk them through that?
So, for iPhone neck, appropriately coined. The important thing is, and you can do this seated, you can do this standing, or you can even do it lying down. But I'd say the important thing is that your gaze is straight ahead. So when you do it, you're not looking up, you're not looking down, you're looking straight ahead, and then it's like you're retracting your head back. And for some of us, it might feel pretty tight in the back of the neck. If it's painful, you want to stop short of that. But when the neck is forward, all these little muscles are getting held kind of short and tight, right? When we retract it back, it's going to lengthen those muscles in the back. And you just want to try to hold it for about 10 seconds and relax. It also gives you an awareness of your normal positioning, because when you relax, you're like, how did I end up here again? So your vision stays the same, and this is even if you're on a computer for periods of time, stick little Post-it notes up there to remind you. So everyone keep your vision straight ahead, retract back, hold. Any pain with these? Joe? A little bit? Uh-huh. So what I would say is see if it gets better as you do more, because if the muscles relax, and if 1 felt kind of tight and icky, but 5 felt better, 7 felt better, then you're doing what you need to do. If it ever gets worse with what you're doing, then that's something where things might need mobilized a little bit better in that area to give you the freedom of movement to do the exercise. So any exercise that you're working on your own to better yourself, the no pain, no gain theory does not apply. It absolutely doesn't apply. It might not feel great on number 1, but it should certainly not feel worse by the end. It might feel different, but not worse. So this is a good one. I do this driving. Stoplights.
I think you're right about our chairs force us into this position. I know even my comfy chair at home, my recliner, has my head forward. And on the cars.
So we have a physical therapist do something genius, and I don't know what the Automobile Association will say about this. You know how all the headrests on your car kind of jut your head back forward?
Yes.
She went out and took it off for one of our patients and turned it around. And like my mind was blown. I was like, that is so much more comfortable. Now, my husband doesn't like it because he's taller than I am, so it wasn't great for him. And again, I'm not sure what the Automobile Association would say about that. But they are so projected forward. Now, if you took something like a towel roll and moved you out just a little bit, then I think you find your head would hit a little more neutral. But little things like that. And again, it's, you know, if you drive 30 minutes, maybe it's not a big deal. But if you're driving a couple hours, yeah. And airplane seats are the worst. I don't think those are made for.
So the other one they got a copy of
Yes.
is to open up the pecs. So
Okay.
if you want to just run through that, I don't know if there's room in here for them to get up and do it, but you're welcome.
So the one for the chest, I think it'll be on the back of your neck one. Yeah. Yes. Okay, so they have you in a corner. Everybody's house is different, whether you have more corners or more doorways. What I think is important about any home exercise is you build it into your life. Some of my best patients have their bands tied onto their bathroom door. And that is exactly where they do their shoulder exercises. That is where they do their stretches. Door frames are a little bit tough because we don't all have the same wingspan. So if there's a corner, okay, I'm gonna kind of come here to show you guys what to do and what not to do. If you were using the corner for the stretch, What you're not doing is trying to push the wall away from you. You're only using it for hand placement. So your hands rest on the wall. And again, you're trying to at least be aware that you're trying to keep this part of your body straight. You're not trying to move into it or bend your back. From here, you just step forward and let the chest stretch. And again, it should feel good. It should not feel bad. And you can change if hand position feels better here, if it feels better here. You do what works for you, because you're not trying to create shoulder pain by loosening up your back
Now,
muscles.
please come to your.
Okay. So, hands, for me, I do it about shoulder height. You might want it lower, you might want it higher. But from here, all I'm gonna do is put one foot forward, step into it, and stretch out the chest. And then one other one that complements this really well is if you're sitting, just pinch your shoulder blades together and relax. Just pinch them and relax. Because if they're constantly on tension, they hurt, they ache. They're not getting good blood flow. And then when you need them to work, they're not working. So if you're sitting, just pinch and relax. You don't need any resistance. You're just trying to shorten the muscle and relax the muscle.
Marlene does enough.
Yes? Did you guys just come from doing that?
Yes.
Such underappreciated muscles.
But the first one, when you're tense, it's the first one that hurts.
Everything elevates. Yeah.
Shoulders up.
Yeah.
And shoulders down.
Yes. Because sometimes you don't realize they're so high up until you have to press them down.
She reminds this one. She reminds, yes, I remind them all the time.
I get a pain right, I get a pain right here,
Mm-hmm.
okay? Especially when I'm playing on my job.
Right, but you're thinking, you're strategizing. Oh wait,
Yeah,
it's not hard.
I know,
It's
it's
tight.
little times.
Yeah, so you're looking probably forward head, right?
Right,
So you need to get all your game partners to stop and kind of retract back. Plus you guys
and
make
blow your
really
shoulders.
fun faces. with each
Oh,
other.
Good exercise, okay. I
Right?
have to remember.
So that one's on you. You gotta get everyone on board with that one.
Yep, this one.
And in your little goodie packets here, because I appreciate chin tucks. The little groovy thing is to open jars.
Oh.
At home, we call it the rubber husband. No offense. But I don't know about y'all, but I think we all lack the grip strength to open those jars.
Some of them are terrible.
So there are plenty of extra if you have friends that need them.
Oh, is that what it is?
That's what that is.
Oh.
And then there's a chip clip, I don't know, who doesn't need a chip clip? And there's lots of information, I left some brochures, some cards. My business card is up there too, I don't think I have put them on all the things, just grab one if you need to like interact with me personally. Otherwise, it's contacting the office, if it's insurance questions, they're better than I am. But if it's, you know, anything. Thank you.